Welcome to the webinar on Poverty, Hunger and Disability, the Missing Link. This is the fourth in the series of webinars, which we've been doing from the last years. And we are focusing, today we are focusing on towards living independently in community with dignity for all persons with disabilities. The previous webinars brought back the focus on the impact of poverty on persons with disabilities. We also discussed some solutions to address the same. One of the key solutions that came up was focusing on community-based rehabilitation services for all persons with disabilities, particularly those living in low and middle income countries with huge geographical diversities, remote island countries, and so on. The purpose of this webinar is also to ensure that home and community-based rehabilitation is in the proposed World Health Assembly resolution on strengthening rehabilitation in health systems that is to be adopted in the World Health Assembly to be held in May 2023. Currently, this is absent in the World Health Assembly Resolution 76.8, highest attainable standard of health for all persons with disabilities, and in the WHO Rehab 2030 call for action. Today, we will be discussing the impact of community-based rehabilitation on the effective inclusion of persons with psychosocial disabilities and mental health issues. And also, we are highlighting the marginalization experienced by carers of persons with disabilities. Now, I request Venky to give the welcome address.
Greetings, Happy New Year, and a warm welcome to each and every one of you. Today's webinar is about hope. The three presentations today will show how effective psychosocial support services can be with the active involvement of communities and local authorities for people with disabilities to live independently with dignity in communities. Why are these local initiatives so important? Here are some facts. 792 million people worldwide reported impaired mental health in 2017. Okay. This figure forms a whopping 11% of the global population. %75% of these people do not get treatment or support whatsoever. Mental health conditions also produce economic losses to the tune of $1 trillion, with depression being the leading cause of illness, mental health, and disability. These figures are overwhelming, but we also need to understand what they mean for vulnerable people with disabilities, especially those with psychosocial disabilities. Here is what we know. People living in poverty are unequally affected by mental illness. Poverty has increased globally since the COVID-19 pandemic. The increase is 3 times higher in rural areas than in urban. The interaction between food insecurity and mental health is one of the main sources of global mortality and disease. People living in socially underprivileged and poor city areas suffer more often mental disorders such as depression, anxiety, psychosis than those who live in high-income neighborhoods. Social cohesion gives people a sense of belonging and a solidarity with community. This combined with gross household income substantially influence individual mental health. Lack of family and neighborhood resources can lead to more stress, isolation, discrimination, and vulnerability to mental disorder. These can further stigmatize people. Family and peer support structures are essential for mental well-being. Community and environmental processes reflect social differences and social inequalities. These directly impact a person's mental well-being. But this webinar is about hope, not about despair. The three presentations will show how local interventions in resource care settings are building cohesive, socially cohesive communities for people with mental health.